transposition of the great arteries, the TGA. So why it is important to know the diagnosis of TGA? Because now it comprises the 5% of the congenital heart disease, and the important cause of morbidity and mortality over here if you cannot diagnose it faster and effect treat prompter. The the what it is, the arterioventricular atrioventricular concordance, that is the left ventricle with the left atrium, right is right atrium is not but here the uh, left ventricle gives rise to the origin of the pulmonary artery, and then reverse, then right ventricle aorta instead of the reverse. So there's two circuit, one left circuit, other one is right circuit. If there is no communication between the right and left service, patient is not going to survive. So usually 50% or more these children do have a communication by a PDA, at times by the ASD and VDA and BSD, and foramen ovale either. So how do they present? These children present with cyanosis and your tachypnea, faster breathing, appearing to be pneumonia at birth, usually at birth. So there may not be any murmur until and unless the PDA is larger, and then other communicators like VSD and ASD, they are prominent. So very difficult situation, appears to be pneumonia, but so then you do go for the testing, the your pulse oximetry, and then your hyperoxic test, not that useful. And echo is color Doppler echo is a good standard. It will reveal the aorta arising from the right ventricle and pulmonary artery arising from the left ventricle, with or without communication. So how do you diagnose further? The X-ray. What X-ray shows? It shows the pulmonary plethora, pulmonary oligomia, and then and finally cardiac catheterization is essential because coronary artery arising from the aorta here needs intervention. So treatment of those cases, the definite treatment is the arterial switch. It's very challenging surgery. Very few centers till date globally do it. So thereby, and before that, then you can try. Should give the you may give the prostaglandins. It keeps patency of the PDA. And but when you give the prostaglandin, there is little bit of chance of having apnea. In those cases, get ready to tackle apnea with resuscitation, and endotracheal intubation may be needed. And keep patient warm. Treat acidosis and infection if they are there, and if no improvement, if you cannot do the usually the your total the arterial switch, the Jettini procedure, the shifting the arteries in the respective normal position, it is being practiced by 2 weeks or so. When you cannot do it, you cannot wait for 2 weeks, you can go for the septostomy, Raskind's intraarterial balloon septostomy. So other procedures previously sending, and then your your mastered, but they are not nowadays in practice globally. So diagnosing TGA early, effectively, and handling it the good center with a good team of good cardiac surgeon, good pediatric cardiologist is essential.